Are you having high blood pressure in spite of taking medicines, blood pressure medicines? Then you are not alone. There are a million people around the globe who are having persistently high blood pressure in spite of taking blood pressure medications. The problem is not with your blood pressure medication. The problem is with your few lifestyle changes which you need to undergo. In today's video, I'll discuss about 5 lifestyle changes which you need to take so that your blood pressure remains controlled and you can prevent yourself from the complication of uncontrolled blood pressure. In my practice also as a cardiologist, I tend to see lots of patients who are having uncontrolled blood pressure, and because of this uncontrolled blood pressure they land up in problems like complications like heart failure or heart disease, heart attack, kidney disease and eye problems and stroke. So what are the causes of this high blood pressure? The reason number one is excessive salt intake. All of us are aware that salt is detrimental for high blood pressure, but most of us think that if we do not take extra table salt then we are safe from having an extra salt in our diet. But that is not the truth, because most of the time this salt which we take are actually hidden salt which are not in the form of a table salt, and we tend to take much more salt compared to what is recommended by WHO or World Health Organization, and it has a tremendous impact on our blood pressure management. In fact, lots of studies have been done, and these studies have shown, especially in Indian context, we tend to take much more sodium or from table salt compared to the recommendation. The recommendation is to take less than 5 gram of sodium chloride, but we take up to 3 times of that, up to 17 to 18 grams of sodium chloride we take in our diet most often, and most of them are in the form of hidden salt. So which are the sources of this hidden salt? One of the sources is pickles and papad. Especially we as an Indian, we want a spicy food, and to add that spicy food we have pickles most commonly with our food, and pickles and papad actually they have lots of salt as their preservative. So if you are on a hypertensive, try to avoid pickles and papad, especially those pickles which are salt based. Another important food which comes next is namkeens and bhujiyas, and namkeens and bhujiyas are too salty. So if you are having a high blood pressure, try to avoid namkeens and bhujiyas. As an hypertensive, we avoid salty biscuits. But do you know this biscuits which are not even salty also contains significant amount of sodium chloride. So any form of biscuits or cakes or muffins you need to avoid, along with the bread as well, the simple white breads. Most surprising for you could be a tomato ketchup, because tomato ketchup also have a lots of sodium in them. So if you are on hypertensive or if you are having a kidney disease, try to avoid tomato ketchup. And all the processed foods, those who are in the cans or jars, they have lots of sodium. So all those things you need to avoid if your BP is not getting controlled even after taking multiple medications. But the most important, the time bomb, the total salt bomb is the dried fish, because dried fish actually is most often consumed in the coastal area, and dry fish, in order to preserve the dry fish, lots of salt are being added up to 20%, 15 to 20% of the dry weight of the fish, and this adds significantly to the salt burden. Sometimes the salt burden could be as high as 18 gram also per 100 gram of fish. So if you are on hypertensive, if you are having a kidney disease, you need to avoid this salty bomb, that is the dry fish. So what you can do to avoid all this hidden salt? Very few important steps you can take to avoid this hidden salt. Number one, you should read the label. Every food packet has a label, so see if there is an excess, how much salt does it contain. Second, choose fresh foods over a packaged food. Third, go for a salad instead of going for pickles and papad. Fourth, most of the time we take salted nuts as our snacks, so avoid the salted nuts. Rather, you go for unsalted nuts, dried nuts, unsalted nuts, or unsalted dry roasted chana. These are a better option compared to going for a salted nuts. Although salted nuts are tasty, but this adds significantly sodium burden and BP doesn't remain in control. And use natural herbs and spices. And very commonly, if you employ all those things, your taste bud gets used to the low salt, and you get used to this low salt. So employ all those things, whatever you have discussed till now, so that you avoid excessive sodium in your diet and prevent the blood pressure to remain elevated. Second reason why your blood pressure doesn't remain under control in spite of taking medication is various disease conditions like kidney disease. Very commonly we are not aware of that we are having a kidney disease. So if your blood pressure is not getting controlled, get it checked by a doctor whether you are having a silent kidney disease or not. Second, various thyroid disorder, especially high thyroid or low thyroid, which is known as hypothyroidism or hyperthyroidism. This also can contribute to an elevated, persistently elevated blood pressure. So check your thyroid levels if your blood pressure is not getting controlled. Third, if you snore excessively, which is known as obstructive sleep apnea. So if you snore excessively, your body weight is high, if you have excessive daytime sleepiness, probably you are suffering from a condition which is known as obstructive sleep apnea. And obstructive sleep apnea also contributes to elevated blood pressure. If you have all these features, go and consult your doctor. Probably the doctor will advise you to undergo a sleep study. So if you have all those medical conditions, like if you have a kidney disease, or if you have an endocrine problem like thyroid problem, or a snoring issues like obstructive sleep apnea, it could contribute to a persistent elevated. So till now we have seen that excessive salt intake, especially in the form of hidden salt and in the form of various namkeens and bhujiyas and papads, pickles and processed foods, as well as dry fish, contains lots of salt, which we need to avoid and go for more of a fresh fruits, go for unsalted foods, go for fresh herbs and spices, as well as you need to see whether you are having a medical condition which is contributing towards an elevated, persistent elevated BP. Third reason, and one of the most common reason of a persistently elevated BP not getting controlled by medication, is faulty assessment of blood pressure, which we have discussed in our previous video as well. You can refer to our prior video. If you have a faulty blood pressure assessment at home or at the clinic, you can have a persistently elevated BP. Your BP may not be elevated, but because of faulty technique, it is showing a high BP. So there are various reasons for that. One is the cuff size may not be adequate. It might be too small a cuff size which is being used to assess your BP. Second, the cuff positioning may not be proper. Third, there might be excessive talking while you are checking your blood pressure. Fourth, your bladder might be full when you are assessing the blood pressure. And fifth, you probably haven't rested adequately before checking your blood pressure. So all these are common mistakes which are being done when the blood pressure is being checked. So avoid all these mistakes if you want to have a proper assessment of the BP. Fourth reason why your blood pressure may not be controlled in spite of taking blood pressure medications are various lifestyle features, like you are excessively smoking or excessively drinking, or your exercise, you are not exercising adequately, you are having sedentary lifestyle, you are having excessive stress. So all those contributes to persistently elevated BP. And another reason, especially in Indian context, is taking various forms of tobacco, like in the form of gutka or khaini, or those who consume pan. Zarda is also one of the most important reason where the blood pressure doesn't remain controlled although you are taking medications, because all these products contains tobacco, and tobacco causes various sympathetic overactivation which can elevate the blood pressure as well as damage the blood vessel. So it not only causes elevation of blood pressure, but it can also damage your heart blood vessels, causing even heart attack also. So if you are having high blood pressure, you need to avoid all those things altogether. Number 5 reason, which are not also uncommon, is few medications which you are taking thinking these are innocuous, which are not harmful, but they are interfering with your blood pressure medications. One of the common medication being a pain medication, which are known as painkiller or NSAID, non-steroidal anti-inflammatory drugs like ibuprofen and all. So all these drugs, for whatever reason, pain you are taking, suppose you are having nagging pain, arthritic pain, and you are continuously taking NSAID or painkiller, which can elevate your BP. So if your BP is not getting controlled and you are taking a pain medication, go and consult your doctor. Probably you need to come off your medication, need to give some other painkiller medication which won't interfere with your BP. Another important medications which people consume sometime as a prescription drug or sometime on their own is steroids. For whatever reason, some might be having asthma or some other problem, for that we are taking steroids, and steroids also can lead on to elevation of the blood pressure. Few antidepressants also can elevate the blood pressure as well, along with few herbal supplements which are unregulated can elevate blood pressure. Few nasal drops, which some of us have a nasal congestion, persistent nasal congestion, and persistently we tend to take these nasal drops, and these nasal drops can lead on to elevated blood pressure, especially nasal drops like Xylomet, which has a composition of xylometazoline or oxymetazoline. Very commonly brand name are available, and this branded medication which contains xylometazoline and oxymetazoline, if they are persistently being taken as a form of therapy for nasal congestion, it can cause persistently elevated blood pressure. So if you are having persistent elevated blood pressure, try to switch over from this nasal decongestant therapy and try to have any other form of nasal decongestant, especially in consultation with your ENT doctor. Another common medication is cough syrup, especially cough syrup containing ephedrine or pseudoephedrine. So this two group of cough syrup or cough suppressant can also, if persistently taken, can lead on to elevation of blood pressure, and blood pressure may not remain in control. Another, especially for women, it is important, is oral contraceptive pills. So if a woman is more than 35 years of age or are obese and smoking, taking, and if they are taking an oral contraceptive pills, chances are there it can contribute to elevation of BP. So all those medications actually hamper your blood pressure control, and if you are taking any of this medication, it's better to consult a doctor and it's better to come off this medication, otherwise your BP may not be under control. So these are all 5 reasons where your BP is not getting control, blood pressure is not getting control in spite of taking the blood pressure medication. Number 1 is excessive salt intake, especially common in Indian context. We tend to consume lots of salt. We have discussed which are the hidden sources of the salt. Second, concomitant medical disorders like you are having a sleep apnea, excessive snoring, or having a thyroid problem or a kidney issues can lead on to excessive elevation of blood pressure not getting control. Third reason, and one of the most common reason, is faulty blood pressure measurement technique, which you have discussed in details, and we have made a video also regarding that, and you can refer to our video in the playlist. Fourth reason is lifestyle changes, excessive stress, alcohol, smoking, excessive tobacco intake like khaini, zarda, gutka and all this. Last but not the least are few interfering medication which you are taking for some other reason, and these are interfering with your blood pressure medication. So kindly give us a comment and let us know if any of you are having a persistent blood pressure problem even after taking the blood pressure medication, and which all among all those things which one you are suffering from. And if you like our video, kindly like and subscribe and share our channel to somebody else. And if you like this video, you can follow this video which talks about how to assess blood pressure correctly at home, because as we have discussed in this video, if you do not check your blood pressure properly, your blood pressure control will be hampered. And thank you all for your patient hearing.